mild symptoms. Basically, what actually happens in menopause, when a woman reaches a menopause, her ovaries stop making the estrogen. So now, because she has a low estrogen, she can have hot flashes, sudden feeling of heat, night sweat, mood swing, poor sleep, vaginal dryness. These are called the vasomotor symptoms. So first of all, we will check that how bad the symptoms are. If they are mild, which means they are just the occasional symptoms, you will try to do the behavioral modification or try the lifestyle changes first before going towards any medical option. But if the symptoms are moderate or severe, which means they occur daily or they are disturbing the work or sleep, then you should consider some medication. If your symptoms are mild, you can simply try the behavioral or lifestyle changes, like you ask the patient to wear light clothes or to sleep in the cool room or to avoid spicy food, caffeine, alcohol, to quit smoking, exercise and lose some extra weight, practice relaxation or breathing techniques. So, if this helps, there is no need for medication. So, these are generally the recommendations or behavioral modifications we ask the patient to do in case of mild symptoms. But if the patient's symptoms are moderate or severe, then we can decide if we can put the patient or women on estrogen or not. Because if the symptoms are severe, then we have to start some medical option, and the medical option we have is estrogen. So before starting estrogen, we have to look for contraindication if present or not. For example, if a menopausal woman is having some estrogen contraindication, we can't start the hormonal therapy right away. So first of all, we see that if estrogen is not safe, some women can't take estrogen because it can make certain diseases worse. So the contraindications or unsafe conditions for estrogen are if there is a history of breast cancer or endometrial cancer, if there is a history of heart disease or stroke, if there is a history of blood clots like DVT or pulmonary embolism, if there is a history of liver disease. These are the conditions in which the estrogen is not recommended, or these women should avoid the hormones and go for some non-hormonal therapy options like SSRIs. So, if your patient is having some contraindication to estrogen, you can't start the hormonal therapy. You have to put patient on non-hormonal therapy thing like SSRIs. But if your patient is not having any contraindication, then you will see that um, uterus is intact or not. If the uterus is intact, you can start estrogen and progestin. And if uterus is not present or uterus is not intact, you can put the patient on estrogen only therapy. For the non hormonal medications, we have options like SSRIs or SNRI. It will help to calm down the hot flashes by acting on the brain center. You can give gabapentin, it will reduce the night sweats. You can give clonidine, it is a weak option, but it is used only if nothing else works. So majorly you have SSRIs, SNRIs, and gabapentin that can be given as a non-hormonal therapy options for the menopause treatment. Then we have discussed that if estrogen is safe, you will look at the uterus. If uterus is present, you can give estrogen and progesterone both. But if the uterus is removed already or hysterectomy has been done, then you can give estrogen only. Clear?
Okay.
When you start the hormonal therapy, few things you need to consider clinically. You always start with the lowest effective dose and you try to stop the hormonal therapy within 3 to 5 years. You have to review the patient yearly, and you can also have some transdermal or skin patches option for estrogen that can cause the fewer side effects as compared to oral pills. So it's not like that if you put a patient